Good morning, members of the media. This morning I'm joined by my cabinet colleagues and the Chief Medical Officer to give an important update on the recently concluded meeting of the Public Health Emergency Response Team and the actions of which the government is taking in regards to the coronavirus. Earlier today, I attended a meeting of the Public Health Emergency Response Team, which has been meeting regularly since the outbreak of the COVID-19 virus. Led by the Ministry of Health, as of last week, this body mirrors the EMO structure with which we are very familiar and brings together all relevant agencies to coordinate our efforts at preparing for this urgent public health crisis. There has been a daily flow of information to the public as we are determined to learn lessons from those countries where the virus is spreading more rapidly and there are recorded cases of both seriously ill persons and, unfortunately, deaths. The principal objective of today's meeting was to confirm the plans and identify any additional resource needs of all agencies in preparation for the worst-case scenario. As we watch the rest of the world combat the various issues that arise as a result of the aggressive spread of the virus, we have the opportunity to be nimble and to develop plans that will mitigate the impact on Bermuda. There are some realities for which we must prepare, even if things do not reach a crisis point in Bermuda. However, I can confirm that as of last week, the governor of Bermuda has secured capability for employees to work remotely in the event that we may need public officers to work from home. The Ministry of Education has an existing plan for health-related events like this, which is being revised in the event that we will need to deliver curriculum to students outside of the traditional school classroom setting. Later today, the Minister of Finance will be meeting with Bermuda Banking Association, and additionally, the Minister of Finance and I will meet with hospitality, local, and international business representatives to ensure both business continuity in the event of a worst-case scenario, as well as fair and equitable treatment for workers who may be impacted by COVID-19. I have met with the U.S. Consul General and the Governor to confirm our requests through diplomatic channels in the United States of America and the United Kingdom for additional equipment for use by our first responders and the general public. And I have directed that all non-essential travel be canceled for members of the public service and for all public authorities. Following today's meeting, I am pleased to further update the public on actions taken to provide localized testing for COVID-19. Testing kits have been ordered and have shipped to Bermuda and are expected on island shortly. The ability to test and have further results is critical to mitigating the risk of community spread of the virus. Many additional items, such as personal protective equipment, masks, gloves, hand sanitizer, and temperature monitors to support our health services and augment our border protection activities, are en route. The Minister of Finance has made the necessary funding available to support these preparatory stages and any further measures which may be necessary. At this time, the Civil Service Executive is meeting, and as part of its agenda today, the leadership of the public service is ensuring that all plans are in place and in a state of readiness to protect public service employees who, in many cases, provide frontline services interfacing with the public. Daily updates are being released by the government, and yesterday's update indicated that we are awaiting additional results of tests for COVID-19, and our hope is that those tests will also be negative. Irrespective of the results, there is a need now for us as a community to exercise sensitivity and to adopt different practices in our everyday lives. We will have heard the term social distancing, and it is now something that we all must adopt. We will need to curb our natural affinity to shake hands, kiss, and hug on greeting each other, whether in our workplaces, churches, or places of entertainment. We must be prepared to do all that we can to ward against community transmission in the event that we may have COVID-19 on our shores. The best way to protect our families and loved ones is for all of us who call Bermuda home to be vigilant and deliberate in our actions. In addition to practicing social distancing, there are the key messages that I must reemphasize in the interest of public safety. Every Bermuda resident must wash their hands frequently with soap and warm water. If you're unable to wash your hands, use hand sanitizers. If you cough, please do so into your elbow or into a tissue and dispose of that tissue. Disinfect surfaces frequently and avoid close contact with anyone displaying cough and fever symptoms. If you have a cough or a fever, please stay home and call your doctor. If you do not have a doctor, please call the hospital on 239-2009. Do not go to your doctor's office. If there are COVID-19 cases detected on our shores that cannot be traced to recent travel history, there may be a need for further action to limit the spread of the virus. This may involve postponing events and canceling public gatherings. However, those decisions will be taken tomorrow based upon advice of our public health experts. We are committed to keeping the public informed and to ensuring that we employ all the means at our disposal to keep Bermuda and the people who live and work here as safe as possible in light of this rapidly changing situation. I urge members to follow the official notices from the government of Bermuda at www.gov.bm/coronavirus. This site contains the latest statistics and is the source that all residents should use for official information from the government of Bermuda. Daily notices are also available on the Tree Frog app, which can be downloaded to your mobile phone and are being shared on all government social media accounts. In closing, stay calm. This is a time for unity and collective action. It is a time to reinforce the sensible steps necessary to minimize any possible transmission in Bermuda and keep our loved ones safe. The coronavirus is a threat, but there are examples of many countries around the world that have taken strong action to minimize that threat. I am confident, following today's meeting of the Public Health Emergency Response Team, that together Bermuda will do the same, and our unity during this time of challenge will ultimately be our strength. Thank you.
Question? John?
Sorry, did you say that we're likely to hear tomorrow as to the status of public gatherings and future events?
There has been no decision at this point in time to cancel public gatherings. As it remains, there have not been any diagnosed cases here. There has been intense monitoring at our borders, intense community surveillance as well, and there are test results that are pending. We will act on the basis of advice from public health experts, but at this point in time, what we're encouraging is social distancing. We recognize that many private companies are having their workers work from home and other aspects, but as more information comes to light, there may be further steps necessary. At this point in time, we have not made any decision on those particular matters, but we are preparing to make sure that we are able to put those things in place should it become necessary.
Just to make sure I have it, because people are wondering about the status of the games, the corrected games and things like that. So we may be hearing something further on that tomorrow, did you say?
The CRIFT, I'm not going to say specifically on that issue. It is all issues regarding public gatherings. What I am saying is the CRIFTA Games was inside of the Burt meeting today. We will continue. There are going to be further discussions with the public health experts, and then we're going to take additional advice on those particular matters.
We're getting a lot of questions as well. Obviously, it's early days, but the possible status of travel to the island, flights and shipping, things of that nature. Can you, in the event that we were to detect cases here, can you speak a bit to what we might be looking at in terms of travel to from the island?
I do not believe that Bermuda is still regarded from the United States as a level 1 jurisdiction. There is additional information that is being processed regarding the United Kingdom, as we know that some of our CARICOM countries, our fellow CARICOM countries, are considering restricting travel from the United Kingdom. The public health authorities, the Minister of Health and the Chief Medical Officer will be meeting at 12 o'clock and will provide further updates on that. What is most important is that people pay attention to official government updates. We are releasing official government updates every day, and we will continue to release official government updates at the website www.gov.bm/coronavirus. In regards to the second part of your question regarding shipping, there is no perceived threat to supply lines from the United States and shipping that is coming to Bermuda. Those are things that were regularly checked as part of the Public Health Emergency Response Team and the other bodies that are associated with that. So at this point in time, there is no need for concern at that level.
Just one last question that folks have been asking. In terms of the screening devices, the thermal screening, when are we going to have that in place?
The thermal device, the borders, the temperature monitors have already been ordered, and as I said in my statement, they are en route. Yesterday during the House, the minister had indicated that the meetings were taking place. Those particular items have been ordered and are en route in addition to additional personal protective equipment and supplies.
Good morning. When can the ministry expect those test results to be released?
As you would see on the website, www.gov.bm/coronavirus, all of the testing results which are outstanding and the statistics are listed on that particular website. They are expecting further results in either today, tomorrow, or Saturday.
Because that 4 to 5 day testing period has now passed. I wondered if there was a delay or whether there's a miscommunication.
Well, you may be referring to a specific instance. We're referring to the cases which are outstanding. So the cases that have come back from testing, all the ones that have come back negative. There are a few outstanding matters which we're expecting to get Thursday in the coming days, but all tests which have come back already have come back negative.
So many doctors have said that some patients may be asymptomatic of the COVID virus. I want to know, what is the statistical probability of the virus already being here and us not knowing it?
I'm certainly not going to speak and or to speculate. We're only going to go from the issues of public health. The fact is that we are fortunate due to our isolation and the fact that it's not the high tourism season. There is a possibility that that may be the case. And so we are working to make sure that all of our systems are in place. As I said, the public health team is going to meet again today to give further guidance on those particular matters. I'm not going to speak and to speculate, and I think that speculation is unhealthy. We should trust the doctors, we should trust the team, which have been working on this for weeks. The minute that this virus was identified as a possible threat, the Chief Medical Officer and the Public Health Emergency Response Team have been going through scenarios, have been increasing our supplies that are here on island. The hospital has a number of plans in place and contingencies in case. But our most important thing of which we have to do, if there is cases of coronavirus that's detected on island, the most important thing to do is to slow the spread. That is the objective of the government of Bermuda. It is to slow the spread. The Minister of Health has said previously that it is an inevitability that it will arrive here. But we have to understand the issue is that we have to slow the spread, and that is where the public health emergency is looking at, and the team is looking at that. We must slow the spread. In countries where they have taken aggressive action to slow the spread, we have seen that their public health systems have not been overwhelmed. In countries where they have not taken aggressive action to slow the spread, we have seen that public health systems are being overwhelmed. Our responsibility is to make sure that our public health system is not overwhelmed, and we will take any action necessary to mitigate that.
New York City is becoming somewhat of a hotspot for the virus at the moment. We have frequent flights to and from that area. Would you consider closing down flights from that destination?
As I've said, the particular team that is dealing with the travel advice to the government is meeting following this, and they are going to provide update based upon science. But what I can say is that all the borders, there is strict screening activities, which is taking place, but the point of which you recognize is noted, and we are going to be examining all of those particular travel things to make sure. I think that we've done an effective job at our borders to date. There were some gaps early on. We've done an effective job. There is flights that are being monitored. There's travel history which is being collected from all particular persons, and we're going to continue to beef up those efforts.
Is there a hesitation to perhaps take that aggressive approach and potentially close down travel?
We act on the basis of science.
Okay, anyone? No, thank you.
All right. The thing that I want to close with, this is important, as I had said, this is a time to remain calm, to listen, and to follow official notices from the government of Bermuda. We are going to be increasing the communication which is coming out, but it is important to note that our public health response is about minimizing transition to make sure that our public health system is not overwhelmed. We have seen countries where strong action has led to a containment, and we are going to make sure that the same happens here. All essential services will continue to function. Our shipping lines are not expected to be disrupted, and we are going to continue to make sure that we are able to weather this storm as a collective community. Thank you.